Here's a question for you. If your bank gets hacked, they cancel your card. You get a new one in 5 business days. Problem solved, more or less. If your email gets hacked, you change your password. Pain in the neck, but fixable. But what happens when someone steals your fingerprints? You can't change those. Not today, not ever. And that is exactly what just happened to 1.8 million people who trusted the largest public health system in the United States. Grab your coffee. Let's talk about it. Welcome back to Darnley Cyber Cafe, the show where we break down cybersecurity, privacy, and technology in a way that actually makes sense. I'm your host, Darnley, and if you're new here, welcome. If you've been here before, you know what we're about. Straight talk, real threats, and practical things you can actually do. In today's episode, we're digging into a breach that broke this week and has the security community genuinely alarmed. Not because of the scale alone, though 1.8 million records is enormous, but because of what was taken and what it means long-term for the people affected. We're talking about the NYC Health Hospitals breach. A months-long intrusion, medical records, government IDs, geolocation data, and biometric information, including fingerprints and palm prints. All of it copied out the door before anyone noticed. I'm going to start with how this happened, and I mean really how, not just hackers broke in kind of speak. Then I'm going to look at what was taken and why each category of data matters. Then I'm going to spend some real time on the biometric angle, because that is part of what keeps me up at night. And then we're closing with a practical playbook, 10 things you can do right now if you've become a victim, or if you just want the information to protect yourself going forward. Let's get into it. NYC Health Hospitals, and the acronym is NYCHHC for short, is the largest public health system in the United States. They serve over 1 million New Yorkers, most of them uninsured or on Medicaid. So when I say this is a public health institution, I mean it in the truest sense. These are not people who had a lot of other options. Now, NYCHHC says it detected the breach on February 2nd, 2026. They secured the network, brought in external cybersecurity professionals, and started an investigation. That part is pretty standard. What is not standard is the timeline, because the attackers were not in the network for a day or a week. They had access from approximately November 25th, 2025 to February 11th, 2026. That is 11 weeks, 70 plus days, during which they were quietly copying files. And here's the detail that I really want you to sit with. The NYC HHC didn't get breached because someone hacked their front door. They got breached because a third-party vendor got compromised first. The vendor hasn't been named publicly. The NYC HHC hasn't disclosed who it was. But the pattern is one I've seen over and over in incident response work, and it goes like this. Modern healthcare systems don't operate in isolation. They've plugged into dozens of external vendors, billing platforms, electronic health record integrations, insurance clearinghouses, background check services, lab system. Each one of those vendors has been granted some level of trusted access to internal systems. They have to be, well, in order to do their jobs. So the attacker's problem isn't, how do I break through NYC HHC security? It's, which of their contractors has weaker security than they do? And then they compromise that contractor, inherit the contractor's trusted access, and just walk through the front door. This isn't a new technique. It's not clever or some exotic thing. It is absolutely dominant in large-scale healthcare breaches because the attack surface is so vast and so poorly audited. You've got big hospitals spending real money on their own security posture, and then they've got 40 vendors with varying levels of hygiene, all holding the same keys to the kingdom. The most devastating example of this exact same pattern was Change Healthcare in 2024. A ransomware group hit a health tech company that sat between hospitals and insurance networks. One breach, one vendor, 190 million Americans' medical and billing records exposed, believed to be the largest theft of US medical data in history. The NYC HHC breach is smaller in scale, but the structural problem is identical. And the question that no one wants to answer is, how many other vendors with access to how many other health systems are sitting there right now with security gaps just waiting to be exploited? That's the first problem. The door was left open, not by the NYC HHC directly, but by someone they trusted, and that trust, without adequate verification, became a weapon. Okay, so let's talk about what was actually stolen, because I think when people hear data breach, they think of email addresses and passwords. This category is completely different. NYC HHC has confirmed the following data categories were exposed, and I want to go through these one at a time because each one opens a different attack door. Health insurance plan and policy information. This includes your insurance provider, your plan number, your coverage details. In the wrong hands, this is the key for insurance fraud. Fraudulent claims filed in your name. Procedures billed to your insurer that never happened. And here's the thing. You may not even find out for months until you get an explanation of benefits that makes no sense. Or until your insurer denies a legitimate claim because you supposedly already hit your annual maximum. Number 2, medical records, diagnosis, medications, tests, and imaging. This one is deeply personal. We're talking about conditions you may have not exposed to your employer, your family, or your life insurance carrier. This data doesn't just enable fraud, it enables targeted manipulation. Now, imagine receiving a phishing email that references your specific diagnosis. This is not a generic scam. This is a precision weapon, and people click on those because they feel real. Number 3, billing, claims, and payment information. Financial data is the expected payload in any breach, but in a healthcare context, it's paired with a medical context, which makes it far more dangerous. Fraudsters can submit prescriptions, request refunds, or file claims with far more convincing supporting detail than a standard financial fraud attempt. Number 4, government-issued identity documents, social security numbers, passports, and driver's licenses. This is the full identity theft toolkit. SSNs and government IDs together are everything a attacker needs to open credit accounts, apply for loans, file fraudulent tax returns, or create entirely synthetic identities. The damage from this category alone can take years to fully reverse. Number 5, precise geolocation data. Now this is one worth pausing about. NYC HHC's breach notice mentions precise geolocation data. The current working theory is that this came from metadata embedded in photos of identity documents that patients uploaded to the system. When you take a photo on your phone, that image often carries GPS coordinates indicating exactly where the photo was taken. If your home address wasn't already obvious from your ID, your phone may have just handed it over. That's your home location, your workplace, potentially your daily patterns, all compressed into image metadata that most people don't know exists. Okay, and then there are the fingerprints. The NYC HHC has confirmed that the breach may have included biometric data, specifically fingerprints and palm prints. The full scope is still being investigated. It's currently believed these belonged primarily to employees and prospective employees who were required to submit fingerprints as part of a background check enrollment. Whether any patient biometrics were included is still an open question. But here's what we know for certain. Some number of people had their fingerprints stolen, and I want to be very direct about what that means. Every other piece of data in this breach can, in theory, be remediated. You can freeze your credit, you can replace your passport, you can close compromised bank accounts, you can change your insurance policy number. These are painful, time-consuming processes, believe me, but they are possible. The thing is, you cannot replace your fingerprints. Your fingerprints are permanent. They are used as authentication credentials in border crossing, financial services, law enforcement systems, and increasingly in consumer devices and workplace access control. Once a high-quality digital copy of your fingerprints exists in a criminal's hands, that credential is permanently compromised. There's absolutely no reset button. And this is where I need to raise a question that NYC HHC has not answered. Why were biometrics stored in a way that was accessible through a vendor integration? Fingerprint data collected for an employee background checks has a very specific purpose. It should be stored in a tightly controlled, highly isolated environment, not in a system architecture where third-party vendor breach could reach it. The biometric storage question matters beyond this breach. It matters as a policy question for every organization that collects this kind of data. What is your retention period? Where is it stored? Who has access? What vendors touch that system? These are questions that organizations need to be able to answer before a breach happens, not after. For the people affected, the honest answer is that there is no fix for compromised biometrics. What you can do is become much more deliberate about where and how you use your biometrics going forward. Be cautious about enrolling in new biometric authentication systems. Monitor for synthetic identity fraud. And understand that targeted social engineering against you just became significantly more credible because an attacker now potentially has your fingerprints, your medical history, your home location, your government IDs. That is not a credential set. That is a complete profile. Okay, let's get into the part that actually matters, what you do about it. Whether you've been directly notified or you ever interacted with NYC Health Hospitals as a patient or an employee, or you're just simply watching this because you want to be better prepared, these 10 steps will serve you well. Tip number 1. Check the official notification and enroll in free credit monitoring. The NYC HHC is offering 24 months of free credit monitoring through Kroll, Kroll. Go directly to the nychealthandhospitals.org to find the official breach notice and enrollment instructions. Don't click on any links in emails claiming to be from NYC HHC. Type in the URL yourself. This is tip 0 and tip 1 combined. Tip number 2, freeze your credit files at all 3 bureaus. Go to Equifax, SBRN, and TransUnion directly and place a security freeze. Not just a fraud alert, a full freeze. This prevents new credit accounts from being opened in your name. It's free. It takes about 10 minutes per bureau. And it's one of the most effective tools against identity theft. Freeze today, unfreeze only when you need to apply for credit. Tip number 3. Place a fraud alert with the IRS. With a social security number potentially compromised, file for an IRS identity protection PIN at irs.gov. This requires a 6-digit PIN to file your tax return each year, blocking fraudulent tax filings in your name. Do this before someone else files in your name and you spend years arguing with the IRS. Tip number 4, request your benefits summary from your health insurer. If your insurance information was exposed, contact your insurer directly and request a full explanation of benefits history for the last 6 months. Look for any claims that you don't recognize. If you find something, report it to your insurance fraud department and document everything. Tip number 5, be extremely skeptical of any healthcare themed communications. For the next several months, well, forever, treat any unsolicited communication that references your health, your insurance, or your doctor with heightened suspicion. Attackers with your medical records can craft phishing emails that reference your specific diagnosis, your medications, or your care provider. These will feel legitimate, I know, but they are not. When in doubt, call the organization directly using a number you find yourself, not in that email. Tip number 6, check for passport and driver's license fraud. If these documents were compromised, someone could attempt to use them for identity verification or even apply for duplicates. Contact your state's DMV to flag your license and review your U.S. passport status at travelstate.gov. Some states allow you to place alerts on driver's license records. Tip number 7, strip metadata from photos before you send them. This breach likely exposed the geolocation data through embedded photo metadata. Go forward and strip the EXIF data from any photos you send to institutions. On iPhone, share via mail and select No Location. On Android, use a free EXIF remover app. On desktop, right-click on the file, go to Properties, and remove personal information before sending. Tip number 8, be deliberate about biometric enrollment moving forward. You cannot remediate compromised fingerprints. What you can do is be much more selective about where you enroll your biometrics in the future. Avoid enrolling fingerprints in systems that are not necessary. When you do enroll, ask the organization how the data is being stored, isolated, and what their vendor access policies are. You have the right to ask these questions. Tip number 9, set up account and medical record alerts. Most major insurers and healthcare portals now offer account activity notifications. Turn them on. Any access to your online health portal, any new prescription, any new claim, you want to know about it. The faster you spot something wrong, the faster you can respond. And lastly, tip number 10, get a dark web monitoring service. Your data may not surface immediately, but it may sit in a criminal database for months or years before being sold or used. Services like Have I Been Pwned, your bank's identity monitoring feature, or a standalone service like Aurora or Malwarebytes Privacy will alert you if your email, SSN, or other data appears in known breach dumps. Set it and check the alerts. So that's the playbook. 10 steps, none of them overly complicated, all of them very meaningful. You don't have to do all 10 today, but I strongly encourage you to do tips 1, 2, and 3 before you go into bed tonight. Before I sign off, 1.8 million people woke up this week to find that data they had no choice but to hand over to a public health institution is now in the hands of attackers. Most of them, the remediation path exists. Freeze, monitor, report, verify. It's a pain, I know, but it works. For the ones whose biometrics were taken, the honest answer is that there is no clean resolution. What you have going forward is awareness, vigilance, and knowledge that your authentication posture has permanently changed. Act accordingly. The structural story here isn't just about the NYC HHC, it's about the entire model of trust we've built into healthcare IT, where organizations hand access credentials to dozens of vendors and then cross their fingers that the weakest link holds. It didn't hold here. It didn't hold at Change Healthcare, and it won't be the last time. If today's episode gave you something to think about, do me a favor, hit follow, leave a rating, or share this with someone who needs to hear it. It costs you nothing and keeps this conversation going. I'm your host, Darnley, and this has been Darnley Cyber Cafe, where today we talked about the price of trusted access. Stay sharp, stay private, and remember, the weakest lock on the chain is the one that lets everything through.